Good morning, good afternoon, good evening. Welcome to today's program. Today is February the 17th, 2024. You are all welcome. Welcome to today's program. You are all welcome to today's program. How are you guys doing? How are you guys doing? Today we are going to be discussing about diabetics and blurry vision. Same as retinopathy, but in a different dimension, much simpler to understood or to understand. So this is tailored to be specific in terms of blurry vision. Remember, blurry vision is a symptom of diabetics or any of the diabetics, okay? And it's also a symptom of retinopathy. So this topic is specific on blurry vision. All you have to know about blurry vision is what we're going to discuss this afternoon or this morning or this evening, depending where you are watching me from. So you're welcome. You are all welcome. While I'm waiting for members to join the program, if any of you have any question, you are free to ask any question. Okay, so today we're going to be discussing diabetics and blurry vision. I'm going to be specific on blurry vision. Is same thing as the retinopathy that we discussed last week, but this is specific to one symptoms of diabetes, which is blurry vision. Is also a symptoms of retinopathy. So I'm just focusing on blurry vision. All you have to know about blurry vision in terms of you being diabetic. Okay, so you're welcome to today's program, and please indicate where you are watching from. Indicate where you are watching from. All right. All right. So today we're going to be specific on blurry vision and diabetics. Okay. So I'm going to exercise some patience. I'm going to just wait for a little while, 5-10 minutes. Let everybody come online, and then we start the program fully. Because when I start early, people that are joining late would like to draw us back and start all over again. So I tend to give more time before we start. So today we're going to be discussing about blurry vision and diabetics. All you need to know about blurry vision and diabetics. Okay, it is important you understand the relationship between diabetics and why you are having blurry vision, or what are the linkage. Why do you tend to have blurry vision? Blurry vision comes in different times. It could be floaters, it could be a blind spot, okay? It could be a double image. So I'm being specific on blurry vision and diabetes. The previous weeks we've been discussing in totality about retinopathy eye disease, okay? But in this particular video, I'm being specific to one symptoms of retinopathy and diabetes, which is blurry vision, okay? So uh, I'm going to show you guys how blurry vision occur, what are the linkage of blurry vision, what are the causes, how can you guard yourself against it. Okay, so today's video is going to be interesting. So I'm just waiting for uh, people to join the program, and then we start. Okay, and then we start. Meanwhile, if you have any question before I start, you're free to ask, send in your question on the comment section. If you have any question, send your question on the comment section and I will respond. Okay. Now, if this is your first time, if this is your first time to come across my page and you've not followed my page, I kindly recommend you to follow my page if this is your first time. If you are not yet following my page, if you have not yet subscribed, go to my page and then subscribe on Facebook. All right. So I encourage you guys to follow me on Facebook. If you're a caregiver, you have a loved one that is suffering from this chronic illness, and you're a caregiver, you want to get some information regarding this chronic illness, diabetes, you're welcome to the community. You're also a diabetic patient, and then you are struggling in managing your diabetes, and you lack information, details on how to live with it, you are welcome to the community. Kindly subscribe to my page. Kindly subscribe to my page. All right. So we're going to be discussing diabetics and blurry vision. From the title of the video, we're going to be discussing diabetics and blurry vision. In the past week, okay, I've been discussing retinopathy in totality because retinopathy is an eye disease, diabetic eye disease. So I've been discussing in totality. All you have to know, what to know about retinopathy, how it occurs if you're a diabetic, and how it will affect your eyesight if you're a diabetic and not controlling your sugar level. So for the past week, we've been discussing all in totality about retinopathy, diabetes eye. On this video, all right, I think I'm having a place. For the past week, I've been having some network issue. Um, okay, I believe my network is okay now. Please, if make sure, all right. Flem from Zambia, you're welcome. Chembolusi from Zambia, you're welcome. Flem and Chembolusi, you are welcome. Okay. So, if my audio is not clear, please draw my attention. If for any reason I lost connection, you guys cannot see me, please let me know because I'm having fluctuation in network for the past week. Requested for them to come and look after it. So, as I was trying to explain before, on this today's topic, we are discussing diabetics and blurry vision. For the past week, I've been discussing about retinopathy in totality, all you need to know about retinopathy and diabetics. What is the cause of retinopathy? If you're diabetic and you're not controlling your sugar level, or you've not bothered to control your sugar level, you're going to have issues with retinopathy. So for the past week, we've been discussing about retinopathy, everything that have to do with your diabetes eye. On this particular video, I'm being specific. I'm being specific on a particular symptoms of diabetes and a particular symptoms of retinopathy, which is blurry vision. And that is why the title of the video is Diabetics and Blurry Vision. What do you know about blurry vision if you're diabetic? So that is what I'm going to be focusing my attention today to educate you guys, share the knowledge with you guys about diabetics and blurry vision, which is the symptoms of diabetics and also a symptoms of retinopathy. So I'm being specific on one symptoms of retinopathy and one symptoms of diabetics, which is blurry vision. Okay, so that is what we're going to discuss today about diabetics and blurry vision. Clarence William from Zambia, you're welcome. Welcome to today's program. Okay, welcome to today's program. Let me remove this. Okay, so we're going to be discussing, I'm going to be focusing my attention on diabetics and blurry vision. So if you need to grab a cup of tea or grab a bottle of water, have your pencil and pen. I'm giving you some few minutes to go and do that before we start, so that if you have to write anything down, this is the time for you to go and do it. Okay? So, what do you know about diabetics and retinopathy? I mean, diabetics and blurry vision. What do you know about blurry vision and diabetics? Okay? Blurry vision may be a minor problem. It may be a minor problem that eye drop can help. For instance, you wake up in the morning, you have a little bit of blurry vision, or in the afternoon, it can occur at any time. But when you experience a blurry vision, please and please do not ignore any minor symptoms you see within your body. If you experience a blurry vision, write a date and time and note it down. and continue doing what you're doing. Okay? And see if that same symptom is going to disappear and reappear again. If it keeps disappear and reappearing for 5-7 days, then you have to go and see a doctor to investigate why you're having a blurry vision. No matter how small the symptoms are, because some symptoms will start at minor, at the early stage, and keep graduating to the major stage. At that minor stage, you stand about 80-90% chances of correcting that symptom, not to get worse. So no matter how small the symptom is, note it each time it occurs, time and day. Because when you go to a doctor is going to ask you, when do you start seeing those symptoms? So you don't want to be guessing. All right. So blurry vision may be a minor problem that eye drop can help resolve. Other times, blurry vision may indicate something more serious, like diabetes, or a diabetes-related complication like retinopathy. So blurry vision, when you see it, it may be an early warning sign that you might be diabetic or a complication of diabetic-related illness like retinopathy. So retinopathy is a complication as a result of diabetes because you are not controlling your sugar level. So blurry vision may be a minor problem that an eye drop can help resolve. Other times, blurry vision may indicate something more serious like diabetes or a diabetes-related complication like retinopathy. Okay. Let me share that definition. This is what blurry vision is all about. This is what blurry vision is all about. That's the definition of the blurry vision at the beginning. Okay. It may be a minor problem that an eye drop can help resolve. Other times, blurry vision may indicate something more serious, like diabetes or diabetes-related complication like retinopathy. Last week, we discussed about retinopathy. Throughout last week or a week, and I will be discussing about retinopathy. Retinopathy is in totality of your diabetes eye, everything that has to do with your eyesight. When you have that complication as a result of uncontrolled diabetes. But on today's topic, I'm being specific on one symptoms of diabetes, which is blurry vision. And there's a reason why I choose today's topic on blurry vision. So, because I'm going to be specific on it, and I'm going to tell you at the end of this program, you're going to learn more about blurry vision, why you should take it seriously when you start noticing that symptoms at the early stage. Okay, so that is the definition of blurry vision. It should not be ignored when you start seeing those symptoms. All right. So now, blurry vision means it's harder to make out fine details in what your eye is seeing. So when you are having a blurry vision, it makes it harder, okay, to make out the fine details of what your eyesight is seeing. So it might be blurry, you can't see it clearly, or it might be. Now, let me just try to differentiate. When you are having a blurry vision, it's different from a double image. Because sometimes we tend to mix two together to be the same. No. Blurry vision and double imaging is two different in terms of eyesight problem. Okay. In blurry vision, okay, it makes it harder for you to read out the fine details of what your eyes are seeing. That is what blurry vision is. But on double imaging, okay, you are seeing items appear double on your eyesight. They might not be blurred, but the image appeared twice on your eyesight. So there are two different things between when your eyesight is capturing image twice and when you are having blurry vision. They are two different things. They don't mean the same. All right. So let me just, for the sake of my friends that can't hear me, let me just post this for you guys too. Okay, this is what I just said now. Blurry vision means it's harder to make out the fine details of what you are saying. That is blurry vision. Okay, that is what is called blurry vision. All right. Your eye cannot see the fine details. There are two different things between blurry vision and double imaging. In double imaging, you are seeing items object twice. They appear twice or three times or four times, depending on the sequences. On blurry vision, you are not seeing the fine details. They are not appearing double, but the fine details you cannot make out what it is. It becomes you harder to see it, except you wear an eyeglass. That is what is called blurry vision. So there are two different things. Okay. So let me put back this. Blurry vision may be minor problem that an eye drop can help resolve. Other times, blurry vision may indicate something more serious like diabetes or diabetes-related complication like retinopathy. Okay, so now, and I said, when you are having a blurry vision, it makes it harder for you to see the fine details of what your eye is saying. Okay, now blurry vision can be an early sign of diabetes. I've said it before, it can be an early sign for diabetes. Okay, for those who have a diagnosis of diabetes, blurry vision can indicate your blood sugar are too high or not in a target range. I've told you guys, when your sugar level is above the normal range, when it goes above the normal range, you get that early symptoms of blurry vision. Okay, you start experiencing that blurry vision. Or when your sugar level is not within the target range, okay, if it's not within the target range, even when it's below the normal level, you start experiencing that blurry vision. So it's an early sign of diabetes. Early sign of diabetes. Okay. The reason your sight blurs may be, we said it in the retinopathy about leaking fluid into your retina. Okay. We said it, that is how, when you have blood vessels are perforated and the fluid and blood are leaking into the retina, then you start experiencing those gradual losing of your eyesight. So the reason your sight blurs may be fluid leaking into the lens of your eye. Okay, fluid leaking into the lens of your eyes. This makes the lens swell and change shape. We discussed it in retina. I mean, in the retinopathy, when we're discussing about retinopathy, when you have the blood vessels, then leaking fluid and blood into the retina, it makes the lens to swell, and then your eyesight doesn't maintain the shape anymore. Okay, those changes make it harder for your eyes to focus on things so things start looking confusing. So when there's a leakage of fluid in your eyeballs, okay, the lenses swell, and then the overall shape of your eyesight changes, and that makes it harder for your eye to focus. So things can start looking fuzzy or blurry. So you can't see the fine details of those things you are looking at. Remember, I said blur vision and double imaging are two different things. They are not the same thing. Okay. So you may also get a blurry vision when you start insulin treatment. Another reason why you must start having insulin. You guys remember that there are certain drugs you can take. I don't know, maybe in your lifetime you've taken certain drugs, or you've eaten certain food. Even though if you're not diabetic, you take certain drugs and then you start having that blur vision. You can't see properly. So you may also get a blur vision when you start taking insulin treatment, especially if you're in type 1 diabetes. So, because this, why do you have blur vision when you are taking insulin? Why do you have blur vision when you are taking insulin? This is due to the shifting fluids, but it's generally resolved after a few weeks. Okay, so for many people, as blood sugar levels stabilize, so the vision also stabilize. So once your sugar level creeps above the normal level, you might be experiencing that blur vision. And once your sugar level comes within the target range, that blur vision disappears. So when you start insulin treatments, okay, it can also cause you to have blur vision because due to the shifting fluids, okay, it makes it generally resolve because if your insulin, is as soon as start taking insulin, you start getting the reactions. The insulin goes into work and start mopping out those excess sugar. Then the fluids are moving around. When you constantly take, when your body recognizes now that you are dependent on insulin constantly for a few weeks now, then those blur vision will disappear because your body have now recognized that you are dependent on insulin constantly, and then already in your system you have insulin. So you might, in a few weeks, those blur visions might not reoccur again. It disappears because now your body have recognized now that you are dependent on insulin. So insulin at the first time treatment might also cause you to have a blur vision. But as your sugar level stabilizes, your vision also stabilizes once they fall within the target range. Okay. So now we all know about hyperglycemia. Okay. We all know about hyperglycemia because when your sugar level rises above the normal level, okay, when you have high blood sugar levels or hyperglycemia, they result from glucose building up in the blood when the body lacks enough insulin to process it. That is what we call hyperglycemia. When your sugar level is above the normal range, okay, there is a lot of sugar building up in your system, and there's not enough insulin to regulate or moderate the amount of sugar level in your blood by driving away all those excess sugar into your cells, muscles, and liver to store them. So when there's not enough insulin to do those, take up the responsibility of regulating your sugar levels, and then your sugar keep building up. That is when you go into hyperglycemia. Okay. Besides blurry vision, and other symptoms of hyperglycemia also include headache, fatigue, and increased thirst or urination. These are some of other symptoms of hyperglycemia. We've discussed that in the past. You guys know the symptoms of hyperglycemia: fatigue, frequent urination, increased thirst, you're drinking a lot of water, tired, weakness, okay, the blurry vision that we're talking about, losing a necessary weight that you cannot explain, eating a lot of food. Those are the symptoms of hyperglycemia. All right. So I want to make sure, please, while I'm discussing this topic, if you have any question, feel free to ask your question on the comment section and I'm going to respond. Once any section that you don't understand on my explanation, feel free to send me your question in the comment section and I'm going to respond. Okay. So we all know about hyperglycemia. For those that have been following me very well, it's a medical term that says your sugar level is high, it's above the normal range. That is when you're going, you have hyperglycemia. And blurry vision is a symptoms of hyperglycemia where your sugar level rises. So not only do you have a blurry vision, there are other symptoms of hyperglycemia. Okay, so understand. I'm not going to go into hyperglycemia because we all know about it, except new members that don't know about it. Then you can ask the question, then I'll explain more. But we all know about hyperglycemia and hypoglycemia. Hypoglycemia is when your sugar level is below the normal level or below the target range. Hyper is when your sugar level is not within the target range but above the normal level. So that is when, and they all have similar symptoms of diabetics. Okay. High blood sugar and average A1C level can mean a high risk of diabetes. So when you have a high blood sugar and at the same time have an average A1C level, you're at a high risk of being diabetes or having related complications of diabetes, including health issues such as retinopathy is a complication of uncontrolled diabetes. Glaucoma is a complication of uncontrolled diabetes, and then macular edema is also a complication of uncontrolled diabetes. We've discussed about this macular edema. We discussed about glaucoma. Is what I'm going to discuss more about glaucoma today. Glaucoma and cataract is what I'm going to discuss today because we've discussed retinopathy. The video is in my page. Macular edema, we've discussed about it. The resources is in my page. So for those that doesn't know what macular edema is, they can go to my page and watch the video and get more insight what macular edema is. And then retinopathy, the video is in my page. So if for those that doesn't know what retinopathy, how it started, what is the cause of retinopathy, if you're a diabetic, you go to my page, there is video there, and then watch it. So today I'm going to be concentrating on glaucoma and cataract. Okay. So high blood sugar level, and then when you have high blood sugar level and then an average A1C level, you are at a high risk of developing diabetes or the diabetes-related complications, including retinopathy, glaucoma, macular edema, and even cataract. Okay, so that is why I was focusing more on blurry vision, more on blurry vision. Yes. At any time you have any question, please feel free to ask your question and please indicate where you're watching from. Please, when you join the program, indicate where you are watching from. Tell me where you're watching from so that I can acknowledge you once you join the program. All right. So higher blood sugar levels and then average A1C level can mean a higher risk of diabetes-related complications, including eye health issues such as retinopathy, glaucoma, and macular edema. Okay. So we are going to discuss now diabetic retinopathy just briefly because I've discussed it in the past. So I'm just going to just go briefly about diabetic retinopathy and then the four stages of diabetic retinopathy. And then the next, I'll go to glaucoma. And then the next, we're going to discuss about cataract and macular edema. Okay, so I'm not going to spend much. I'm not going to spend much time on retinopathy because we've done it last week. We have a lot of videos on diabetic retinopathy that you can watch. If you want to understand in totality what is retinopathy, diabetic retinopathy, there's a separate video for it that you can watch. This in this particular section now, or in this video, I'm just going to touch on it briefly because I'm heading somewhere on this particular topic today to make sure you guys understanding why I choose that blood revision and diabetes. So when you have high blood sugar and then an average A1C level, that can mean a higher risk of diabetes-related complications, including eye health issues such as retinopathy, glaucoma, and macular edema. So let's start with diabetic retinopathy. Let's start with diabetic retinopathy. Okay. Let's start with diabetic retinopathy. One diabetic eye complication is diabetic retinopathy. We've said it before in my previous video. If you have uncontrolled sugar level, constant uncontrolled sugar level, one of the complications is diabetic retinopathy. It affects more than 1 in 3 people living with diabetes, no matter what type they have. Diabetic retinopathy affects more than 1 in 3 people living with diabetes, no matter what type of diabetes they have. Okay, so it's a complication of diabetes. If you have uncontrolled diabetes, uncontrolled sugar level for a long period of time, then you're going to have these complications, and then the nerve damages begins. This, at the end of the day, can cause you to go blind if you don't control your sugar level constantly. So, a symptoms of diabetic retinopathy is a blurry vision. It is a symptoms of diabetic retinopathy, blurry vision, and at the same time, also a symptom of diabetes. I use the word diabetic retinopathy. Blurry vision is a symptom of diabetic retinopathy and also a symptoms of diabetes. All right. So, a symptoms of diabetic retinopathy is blurry vision. All right. Now, let's talk about the stages of diabetic retinopathy. I've discussed it in my other video. There are 4 stages of diabetic retinopathy. Okay. The first stage is called mild non-proliferative diabetic retinopathy. Mild non-proliferative diabetic retinopathy. Okay. Now, um, I want to do something now. I want to do something now. Hold on. Please indicate where you are watching me from. Okay, I'd like to know where you guys are watching me from. So, as I said before, I just remember to do something. I said, let me, So, as I said before, a symptoms of diabetic retinopathy is blurry vision. A symptom of diabetic retinopathy is a blurry vision. Now, uh, and I was discussing about the stages. Let me see if this is going to work. Feel free to ask your questions if you are lost. Now let's talk about the stages of diabetic retinopathy. We're going to discuss about the stages now of diabetic retinopathy. Let's talk about the stages of diabetic retinopathy. Okay. And I said number one. I'm trying to let me see if this can work. So we can do it together. Okay, I'm gonna do it this way. Let's do it this way. I want to make sure. Okay. So the stages we're discussing about the stages of diabetic retinopathy. I'm gonna to make it easy. I'm gonna make it this way. Stage one. Okay. Stage one is mild non. No, let me adjust. Let me make it in such a way that everybody can understand. Just hold on. I don't want to cause any confusion here. Retinopathy. Okay. Stage one is called mild non-proliferative diabetic retinopathy. Okay, that is stage one. It's called mild non-proliferative diabetic retinopathy. I'm not going to go into it. It's on my other video about the stages of diabetic retinopathy. Okay. Why I'm giving you these stages is that, as I was saying before, diabetic retinopathy is the symptoms of diabetic retinopathy is blurred vision, and at the same time, it's symptoms of diabetes. Okay, both as symptoms of diabetic retinopathy and the symptoms of diabetes. Now, because one diabetic eye complication is diabetic retinopathy. It's a complication as a result of uncontrolled diabetes. So if you don't control your sugar level for a long period of time, you might have this complication of retinopathy. Retinopathy covers everything that have to do with your eyesight. But today I'm focusing on blurred vision. Blurred vision as a specific symptom of retinopathy and diabetes. Now we're on the stages of diabetic retinopathy. And I said number one is mild non-proliferative diabetic retinopathy is number one. Okay. And then that is the stages, how you start losing your eyesight to the final stage. And that is why you guys have to go and watch the video of macular edema and a hole, what is a hole in the eye of macular edema. That you understand these stages very well. So I'm not going to repeat it again. I'm not going to go into details because I've explained it in details on retinopathy video. So for you to understand these stages of diabetic retinopathy, you have to watch the other video where I explain them in details, how gradually you lose your eyesight if you're not controlling your sugar level very, very well. So number one stage is mild non-proliferative diabetic retinopathy. And the number two stage, okay, this is how stage two is now moderate non-proliferative diabetic retinopathy. That number one mild it's at early symptoms. At that stage, you can still delay or correct any nerve damage that is going to cause you to lose your eyesight because it's mild, it's an early stage. If you catch it at this stage, you start chances of stopping those bleeding, correct all those damages, and then readjust your dieting and take serious control of your sugar level. Now, from mild, if you leave it from mild, you you ignore that symptoms of non-proliferative diabetic retinopathy, it's not going to graduate to stage two, which is the moderate aspect of it. Now it's no more mild. It is now graduating to moderate non-proliferative diabetic retinopathy. At this stage now, you still also stand about 50% chance of stopping those leakages stopping those, don't allow those nerve damage to get worse, and also maintain your eyesight. At stage one, you stand chance about 80-90% of stopping it, correcting it, and living with your eyesight. In stage two, you stand another 50% chance of stopping those leakages and correcting those damages, and then you regain your eyesight at stage two, which is moderate non-proliferative diabetic retinopathy. Now, at stage three, this is where it gets interesting. Okay, at stage three, you have severe non-proliferative diabetic retinopathy. You see how it graduated, how you are losing your sight. It starts from mild, moderate, and now in stage three is the severe non-proliferative diabetic retinopathy. Okay, at this stage now, you stand about 10% chance, or even less than 10% chance of saving some part of your eye or some of the nerves, because now it becomes severe, from mild to moderate and now severe. You are losing your eyesight. You can't even see anymore. You can only see a little bit, just minor sightseeing you can see at this stage. Now, from stage three, that is when it goes to stage four, which is the final stage. Okay, stage four is what did I just sort of. So at stage four, okay, you have proliferative diabetic retinopathy. At this stage, you are totally blind. You can't see anymore. Okay, at this stage, you are totally either you have partially have lost your sight, or you totally lost your eyesight. It's either you have partial loss of eyesight or you have total loss of eyesight. Okay, I want to check something. Just hold on. Hold on. I'm trying to do something here. Okay, so at this stage of proliferative diabetic retinopathy, okay, at this stage, okay, that becomes an advanced stage of your eye disease. New blood vessels are forming and then continue to grow in the retina. The blood vessels, which are thin and weak and prone to bleeding, cause scar tissues to form inside the eye, and gradually the eyesight fade away. Okay, so now uh, let me put something down there for you guys to see. You guys have any question? I'm trying to How are you guys? I'm trying to show something here. Okay, I got it now. Okay, this is what happened at stage 4. At stage 4, it becomes advanced stage of the disease. New blood vessels continue to grow in the retina. These blood vessels, which are thin and weak and prone to bleeding, cause scar tissues to form inside the eye. And once this scar tissue form inside the eye, that is it. That is what happened at stage 4. This is what happened at stage 4, proliferative diabetic retinopathy. Now I'm going to okay. Somebody, let me see what is here. Uh, Zubida, you're welcome. Okay. So this is what happened at stage 4. This is what happened at stage 4. How you totally lose your eyesight. Now I'm going to show you guys. I'm going to show you guys a picture of the 4 stages. When I told you guys. I told you guys when you go to do your eyesight every year, make it's a compulsory. You have to go every year to go and check your eyesight. There's a special equipment that can take pictures of your eye, from everything about your eye, the back of your eye. You just look into that camera, it's going to take a picture, and your doctor can interpret whatever he sees. I'm going to show you guys a picture now. I'm going to share a picture now. Just and hold on, let me see what I can do with my okay. Let me share a screen with you guys now. Um, I'm trying to. Okay. Okay. I don't know if you guys can see this. All right. You guys can see this. This is. I'm going to try to use follow my mocks. Okay. This is mild at the early stage of your mild non-proliferative retinopathy. The beginning. See how your eyesight look. This is the beginning when you start having those leakages and nerve damages. See all those nerves around it here. I want you guys to concentrate on this particular nerves here. You see all these nerves here? Concentrate on it. And then concentrate on the edges. When you start losing, when you have uncontrolled diabetics, concentrate on these nerves, concentrate on the edges. At this stage, okay, you stand a chance of correcting any leakages of fluid into your eyeball or into the retina. I want you guys to concentrate on this particular nerves and the edges. This is when it becomes mild. You stand chance, 80% chance of correcting it. Okay? This one at the early stage, first early stage of non-proliferative, mild non-proliferative diabetic related retinopathy. This is how your optic nerves are. Okay? Now, when you did not control it here at this big stage here, okay, when you do not control, you allow it to go to the next stage, which is moderate. This is now become moderate non-proliferative diabetic retinopathy. Again, watch the nerves how it shifted. Look at the those optic nerves here. This is mild. When it becomes moderate, see how it shifted. You see the growth. You see how the growth start coming up, forming a new blood vessels. You are forming the new blood vessels. Look at the first picture and look at the second picture. That's when it becomes moderate. And then the thickening of the walls. Okay. Now, when it goes to severe, which is the third stage, look at it, severe. Look at how the blood vessels, see all the leakages now? See how all the blood vessels comes. You see now? This is when it becomes severe. Look at those blood vessels. They are forming extra blood vessels in front of your eyesight. Okay? They are forming those extra blood vessels. Remember the stage 4, which is proliferative diabetic retinopathy, says it's an advanced stage of the disease. Now, new blood vessels are continuing to grow in the retina. These blood vessels, which are thin and weak, are prone to bleeding, causing scarce tissue to form inside the eye. So you could see the new blood vessels are being formed inside the eye. See, look at you see how it growth. See, all these are growth. Okay, and also look at the ray. Look at the ray when it becomes mild. You look at this ray here. Look at how it becomes. You see how you can see that the ray here, a little bit of light here. Look at here, and look at how it dims here. And then when you go to the final stage, this is the final stage. This is the final stage. Look at here. Look at those fluid building here. See those fluid? Look at the bed. You see here? Look at the edges here. Look at the fluid. You see the fluid here? And look at those blood vessels that form. Look at the thickness of all this. And this is how it comes and harden and then finally make it to lose your eyesight. You could see that this ray here has disappeared here. And you could see the fluid here. Look at those fluid. Look at how these blood vessels form now in front of the eyeball. Okay, you see how it started from the mild to moderate and then to severe, and now this is the last stage, stage 4. This is the last stage, okay, of your retinopathy. So stage 1, stage 2, stage 3, and stage 4. PDR is the proliferative diabetic retinopathy, which is the final stage. This is severe, this is stage 3, and this is stage 2, and this is stage 1. So this is how, just look at this buildup of fluid here. Look at the buildup of fluid in the retina. Look at all the edges here. If you watch stage 3, you see the fluid start building up here. That fluid is not present in stage 1, it's not present in stage 2, but from stage 3 to stage 4, that is when you start noticing those fluids. And then the new blood vessels and scars, tissue start forming in front of the eye. Okay? So this is how it goes. So let's go back to all right. I believe you guys see that picture very well. Okay. Welcome. Welcome, Jonah. So, so you guys see that picture very well. Now, so you now understand the stages: stage 1, stage 2, stage 3, and stage 4 of diabetic retinopathy. And you know that the symptoms of diabetic retinopathy is a blurry vision. And that include 4 stages. We've discussed the 4 stages now. Now, most people don't have symptoms of diabetic retinopathy. I've said it before, even in your diabetic situation, you might have you're diabetic for a number of times, a number of months and years, and you don't know that you're diabetic because the symptoms are mild. Sometimes the symptoms doesn't even show. All right, except you're one of those people that are very attentive to their body structures that can tell when something is wrong with their body system. So most people don't have symptoms of diabetic retinopathy until it progresses to a later stage. That is why you have to visit your doctor every year. It's a compulsory for your diabetics to make sure you see your eye doctor every year to check your eyes, everything, make a full examination of your eyesight to make sure there's no leakages in the retina. And if there's any leakages in it, it could be stopped, blocked, to not cause further damages and or worsen. So that is why it is compulsory. Whether you are having any symptoms or not, as long as you're diabetic, you must visit your eye doctor every year to check. So most people don't have symptoms of diabetic retinopathy until it progresses to a later stage. Okay, beside the blurry vision, symptoms may include, beside those blurry vision, symptoms may include eye floaters. Okay, symptoms may include eye floaters. I've told you guys what eye floaters is before. Okay, I've told you guys what let me see if I can get a picture of eye floater. Hold on, let me pull out a picture of eye floater and see if I can share with you guys what picture of eye floater is. Um, let me see if I can share a picture. I'm trying to see if okay, I think I can see. Yeah, okay. I think I can. I'm trying to see if I can get a picture to share with you guys about how eye floaters look like. Let me see if I can. All right. Eye floater. Okay. I don't know if you guys can see it. This eye floater. Okay. You can see the picture now. This is your. You see the yellow. The yellows follow the. You see the retina. This is the retina. All these are the retina. Okay. All these are the retina. That is anything that have to do with your eye is the retina. This is the all in all about your eyesight, retina, which is this. Would I call it yellow or what? All this, everything. When you talk about eye, if your retina is gone, you are gone. You can't see that. You become blind. This is all in all about eye, retina. That's your retina. Okay. You see the blood vessels that supply blood to your eyesight. Okay. Now look at the floaters. You see the floaters? Everything here. This is the vitreous fluid. These are vitreous fluid. That's why your eye, you have fluid in your eye, like watery fluid. It's not dry. That is it. All these things are your vitreous fluid. Floaters are these things that are in here. See all those like look like worm? Those things that look like worm are called floaters. Okay? Everything that look like worm are called floaters. This is your vitreous fluid. That is why your eye has water in it. But all these things that look like worm is what is called floaters. Okay? These are floaters. And then this is your retina. So now you guys know what retina is and know what floaters are. Okay? So those things that look like worm are your floaters. So let's go back. I'm going to remove the picture and then we'll go back to I'm going to show you guys the picture of glaucoma and cataract. So stay, hang around. I have the picture of that. Is what I wanted to discuss. We are coming to that area. When we get to that area, I'm going to share a picture of how your cataract, how your eye look like when you have glaucoma, what it look like, and cataract. So let me stop this picture and let's go back. So that are floaters. Okay, so that are floaters. So as we are saying, most people don't have symptoms of diabetic retinopathy until it has progressed to a later stage. Besides blurry vision, there are other symptoms of diabetic retinopathy. Okay, which is eye floaters, is what I just shared a picture with you guys now. Samreta, you're welcome. Watching from Sierra Leone, you're welcome. So eye floaters is what I just shared a picture with you guys now. Now, difficult seeing at night. Difficult seeing at night. So when you have blurry vision, difficult seeing at night, loss of vision, distorted vision, color changes in vision. Now, in the beginning of the program, I said there's a difference between a blurry vision and double imaging. Okay, they don't mean the same. So when you are having a blurry vision, it's different from when you're having double object appearing to your eyesight twice or three or four, depending on the sequences. So just know that blurry vision is not the same thing as double imaging. So you've seen the picture of what is eye floaters, and then we're just discussing other symptoms of diabetic retinopathy except blurry vision. Okay, I choose this blurry vision as a specific symptom of to discuss in relation to diabetes. So at the end of this program, you guys got to understand why I choose this topic, blurry vision. Why am I peculiar in blurry vision? And for those that are joining me late, when the video is downloaded, go and start from the beginning where I define what is blurry vision, what you understand what blurry vision about, and don't ignore the early symptoms of blurry vision. So other symptoms of retinopathy, diabetic retinopathy, not in addition to blurry vision, is eye floaters, which I just shared a picture with you guys. Difficult seeing at night, loss of vision, distorted vision, and color changes in your vision. Okay, while diabetic retinopathy can be reversed, treatment alongside diabetic retinopathy can also stabilize it. When we say diabetic retinopathy can be reversed, does not mean it can be cured. It cannot be cured, but you can stop the leakages, stop worsening the damages, and still regain your eyesight. As long as you catch it early in the mild stage, stage 1, you can block and stop the leakages into the eyeball to the retina. You can repair the blood vessels and save some of your blood vessels and nerves that are connected to the retina by not allowing all the nerves to be damaged and the blood vessels. Because now you're going to block the leakages of the fluid, block the blood vessels, stop the wastage of your nerves, optic nerves, and then make sure you save some of your eyesight. That is what we talk about. Retinopathy it cannot be reversed. It can't be reversed because it has no cure. And I've said before that anything that have to do with the related to diabetes has no cure because they are all linked to diabetes. The only way we can get all these things cured is when we have a medication that can cure diabetes permanently. But as long as diabetes has no cure, all this retinopathy has no cure, but they can be managed. How do you manage it? How do you treat it? Is stopping the leakages in time, block it, repair the blood vessels, save some of the blood vessels, and then retain your eyesight. But it cannot be reversed. It cannot be cured. But as long as the sugar level stabilizes, your vision also stabilizes. So if you're diabetic, the appareil per se, you have to stop your sugar level within the normal range to stabilize your blurry vision. So you guys have seen what floaters are. Now let's talk about cataract. I'm going to show you guys a picture of cataract. Okay. Now let's talk about cataract. These are part of the blurry vision I'm talking about. Okay, these are part of the blurry vision. You might also have blurry vision if you are developing cataract. Okay, see the reason why I was discussing blurry vision today? You might also be having blurry vision if you are developing cataract. People with diabetics tend to develop cataract at a younger stage than other people. Okay, people with diabetes tend to develop cataract at a younger stage than older people. And then cataract causes the lens of the eyes to become cloudy and blurry. Now, let me see here. So I promised to show you guys what the picture of cataract is. Okay. Now, as you age, the lens of your eyesight, we're talking about cataract now. As you age, the lens of your the lenses of your eye becomes less flexible. Okay. As you age, the lenses of your eyesight become less flexible, less transparent, and thicker. Okay. When you have diabetes, high blood sugar levels over time can lead to structural changes in the lenses of your eye and can then accelerate the development of cataract. Remember, when you are older, your lenses are not flexible and they are less transparent and then they become thicker instead of thinner. That is why in younger children they are thinner and flexible. But when you are older, it becomes less flexible, less transparent, and thicker. And when you have diabetes on top of that, again, over time, it can lead to structural changes to the lenses of your eye. And that can accelerate the development of cataract. But the main reason is controlling your sugar level at all times. I'm going to say this. Um, we are discussing about cataract now. Let me talk about it. I'm going to show you guys. This is what we are discussing now. I'm going to show you guys picture of cataract. I'm going to show you guys picture of cataract. Okay, and then we'll talk about the symptoms of cataract again. Um, and what did I say about cataract? Let me see if this can share. Do we have any question? Hold on, let me see if I can put something here. We are discussing about cataract. Hold on. I want to do something here. I want to share something with you guys. What is cataract? What is cataract? Okay, that's what I'm gonna. Okay. All right. Okay. As you age, the lenses of your eye becomes less flexible, less transparent, and thicker. When you have diabetes, high blood sugar, which is blood glucose levels over time, and can lead to structural changes in your lens, in the lenses of your eye that can accelerate the development of cataract. Okay. Now, um, that is cataract. Okay. That is cataract. Let me see. Do we have any question? Okay. So cataract, you might also have blurry vision if you are developing cataract. People with diabetes tend to develop cataract at a younger age than older people. Cataract causes the lens of your eye to become cloudy. Okay, we're going to talk about the symptoms of cataract next. Now, I'm going to show you guys the picture of a cataract. Let's share. I'm going to share the picture of a cataract with you guys now. Let's share a picture of a cataract. And let me see what it is. All right, let me share a picture with you guys for cataract. Okay, this is a picture of a cataract. Okay, this is a picture of a cataract. Now, now you could see a normal eye. Okay, see how a normal eye look like on the left hand side there. You could see a normal eye here. A healthy lens allow for all parts of the retina to receive image. Okay, you could see the picture. This is how your normal eye look like. Okay, remember this yellow line here. This yellow line is your retina. Okay, and these are all, and this is your aqueous fluid here. This is your aqueous fluid. You could see on this eye. There is no floaters. There's no floaters on this eye. This is how your normal eye is supposed to look like. Okay, there are no floaters. And look at the blood vessels, the nerves connecting it. Your retina is this, and your macular edema is this thing that is inside the retina. This is where your macular edema is. It's at the center of the eye. This is your macular edema. Now, this is how your normal eye look like. Now, let's go to, remember, a normal eye allows for all parts of the retina to receive the image. So all parts of the retina receive the image. Okay? See where you see your retina is this yellow line here. This thin line is your retina. So all these images, your eyesight is capturing all the, it goes straight to the retina and send it to your brain to interpret within seconds. See the light, see the image your eye is capturing an image in front of here, and see how it directs that image straight to the retina. That's your normal eye. Now let's go to a cataract eye. I want you guys to differentiate between the two eyes. This is a cataract eye. Okay, look at a cataract eye. When your cataract eye is receiving an image, looking at the same image, instead of sending that image straight to your retina, it scatters them. It scatters the light. It scatters the light. You see, instead of sending that image to your retina to interpret straight away here to your retina, what does it do? Once it goes into your macular edema, it scatters it, that image. It does not go straight to the retina. So your retina did not receive what you are seeing to be able to interpret it for you. That is why it becomes blurry vision. Because your retina is struggling to find out, what are you looking at? I can't get there. You are not feeding me all the totality of the image you're looking at so that I can interpret it for you. So that is why you're having blurry vision, because your retina is not trying to figure out what image are you looking at, because it's not receiving the same image straight to the retina. Rather, it is scattering them. You see, it's how it's scattering them. That's a cataract eye. See how it's scattering that information. So it is not sending it straight to the retina. While on the normal eye, whatever your eye is capturing, it directs straight to the retina. Okay, so that is how your cataract eye look. It's forming a cloud. That is why you're having a blurry vision. I believe it's clear to understand why you are having a cataract. So you need sometime, if it's an early stage, you need a surgery to remove those cloudness to correct it. Okay, or they give you an eye fluid, but most time they use surgery to correct your cataract, to remove that cataract from your eye. Okay, so you can see the difference between a normal eye and a cataract eye, how they process images, why you are seeing a blurry vision, because this one here received the image straight to the retina, and while this one received the image, as soon as it goes into the macular edema, it scatters it. So you can see that it's not going straight to the retina. So your retina cannot interpret what you are seeing. because it's not receiving a complete image you are looking at to interpret it. So that is why you are having a blurry vision, because instead of sending straight to the retina, it distributes it all over your eye. You can see that it's not touching the retina. Rather, it's here. That is why you get a blurry vision. Okay? That is why you have a blurry vision. All right, let's go back to our video. So do you guys have any question? Do you guys have any question before? I'm going to show you guys a picture of glaucoma when we get to the glaucoma section. Okay. Now we're going to discuss about the symptoms of cataract. Somebody is asking me, are cataract common with diabetes? Okay. Somebody is asking me, are cataract common with diabetes? Cataract is one of the major causes of visual impairment in diabetes patients. Yes. Okay. So with diabetes management, with diabetes, people are reported to be up to 5 times more likely to develop cataract. So cataract is one of the major causes of visual impairments in diabetic patients. If you are not controlling your sugar level all times, the possibility of you having cataract is there. So you must take adequate correction in making sure that you maintain a stable within the range sugar level at all times to avoid all these complications. Okay, so to answer that question, cataract common with diabetes? Yes. Major cause of is a major cause of visual impairment in diabetic patients. I believe I've answered that question. Somebody is asking me, can diabetics blood vision be corrected? Yes. Remember, it's diabetes-related illnesses. Why are you having that blood vision? It's because your sugar level is too high. So to correct it, you have to bring down your sugar level within range. So diabetes and blood vision can be corrected as long as you reduce your sugar level within the range. It can be corrected once you have a blood vision. So if your sugar levels crept up more than where it's supposed to be, you're going to have that blood vision. So the only way to regain your eyesight with that is to bring down your sugar level to fall within range. Okay. So let's go and discuss the symptoms of let's discuss the symptoms. Let's discuss the symptoms. What are the symptoms of cataract? What are the symptoms of cataract? That is what we're going to discuss now. What are the symptoms of cataract? And then when we get to glaucoma, I'm going to share a video with you guys. I mean, a picture with you guys for you guys to see how a glaucoma eye look like. Okay. So, what are the symptoms of cataract? Okay. What are the symptoms? Or I'll be right back. Just give me 1 minute. I'll be right back. Okay, I'll be right back. I'll step away from the. Uh, I'll step away from the camera. I'll be right back. I'll be right back. Okay, I'm back. I don't like my attention to be divided when I'm doing a live video. Stepping away is good. All right, what are the symptoms of cataract? Number one symptoms is faded colors. We are discussing symptoms of cataract. Let me put it down there. Symptoms So we are discussing symptoms of cataract. And number one is faded color. Number one is faded color. Number one symptom is faded color. Let me put it down there. Number one symptom of cataract is faded colors. All right, that's number one symptom, faded colors. Let's go to number two. Number two symptom is clouded vision. Number two symptoms of cataract is clouded vision. Let's go to number three. I want to make it fast. Number three is double vision, usually in just one eye. Okay, remember I told you guys there's difference between a blur vision and a double vision. They are not the same thing. So you could see that the number two symptoms of cataract is clouded vision, not double vision. Okay, so clouded vision is your blurry vision because you're blurred, you can't see properly. And the next one is double vision. You are seeing images twice. So there are two different things when you are seeing the difference between a blurred vision or clouded vision and then a double vision. So number three symptoms of cataract is clouded vision, usually in one eye. And that is why when you go for a cataract surgery, they cannot do the same eye at the same time. They'll do one eye this month and then the next eye next month. When you go for a cataract surgery, two eyes can never be done at the same time. They first of all do one for this month and then give you another appointment to come for the next one. So to make sure that you are the one they did is corrected, you are seeing with your eyes so that then they go for the next one. Because if they do the both of them, they might go make a mistake that you're going to lose both of your eye at the same time. So they first of all do one, at least you have a chance to see with one eye. If something goes wrong with the one they did do, they know that okay, you still have one eye to look at. So you do one eye now for this month, and next month you come for the second eye. So that is how they do cataract. It is not done at the same time. Any doctor doing cataract surgery, both eyes at the same day, is taking a chance. But normally it's one eye for this month and one eye for the next time. So that to make sure that the one they did is corrected, you are seeing with it, and then they will take a chance for the next one. Okay, so let's go to number four. Number four is light sensitivity. Number four of symptoms of cataract is light sensitivity. You guys know what it means. You'll be sensitive to light. And number five is glare or halos around the light. Glares or halos around the light. We are talking about the symptoms of cataract. We're talking about symptoms of cataract. And then the final one, number six, symptoms of cataract is vision that doesn't improve. Number six is vision that doesn't improve with new glasses or prescription that must be changed often. Okay, vision that doesn't improve with new glasses or prescription that must be changed often. Okay, so those are the symptoms of cataract. Let's talk about glaucoma. Okay, what is glaucoma? I'm going to share a picture of a glaucoma. What is glaucoma? So what is glaucoma is what we are going to discuss now. So blurry vision can also be a symptom of glaucoma, a disease in which pressure in your eye damages the optic nerve. So glaucoma is blurry vision can also be a symptom of glaucoma. Okay, so it's a disease in which there's a pressure in your eyeball that damages the optic nerve. That is what is called glaucoma. Okay, that is what is called glaucoma. Okay, so if you have diabetes, your risk of glaucoma is doubled that of other adults. That is why you have to see your doctor every year. If you have diabetes, okay, and you are not controlling your sugar level, your chances of glaucoma double that of other adults. Okay, if you're diabetes and your chances of you having diabetes is doubled. So that is why I said you must make sure you see an eye doctor. It's a must every year to go for an eye exam if you're diabetic. So blurry vision can also be a symptom of glaucoma. It's a disease in which a pressure in the eye damages the optic nerves. Okay. So what are the symptoms of glaucoma? What are the symptoms of glaucoma? Is loss of peripheral vision or tunnel vision. Number one symptoms of glaucoma is loss of peripheral vision or tunnel vision. Number two is halos around the light. There is halos around the light. And number three is reddening of the eyeball. I told you when you see you don't need to be a doctor to know when someone have a glaucoma because all the entire eye, everything is going to be turned red. Everything about the eye of that both eyes is going to be pure red. So you don't need to be a doctor to know when somebody have glaucoma because there'll be reddening of the eyes. Now there'll be eye pain because of the pressure in the eyeball that damages the optic nerve. So there'll be eye pain, and then there'll be nausea or vomiting. Nausea or vomiting. These are the symptoms of glaucoma. Okay, these are what is glaucoma? I've said glaucoma is a symptom. Blurry vision is a symptom of glaucoma. It's a disease in which there's a pressure in the eye that damages the optic nerve. Okay, that is what glaucoma is. Okay, so blurry vision can also be a symptom of glaucoma, a disease in which pressure in your eye damages the optic nerve. Okay, that is what glaucoma is. And I said, and I'm going to repeat again, if you're diabetic, your chances of glaucoma double faster than other people with diabetes. So if you have diabetes, your risk of getting glaucoma is double that of other adults if you are not managing and controlling your sugar level effectively. So to avoid you being having a glaucoma or losing your eyesight, it's important you manage your sugar level, let it be within target range all the time. Okay. Now we discussed the symptoms of. Okay, let me share the symptoms. The symptoms of glaucoma. Do we have any question? Those that are watching, do you guys have any question? So number one symptom of glaucoma is loss of peripheral or tunnel vision. That's number one symptoms of glaucoma. Loss of peripheral vision or tunnel vision. And number two is halos around the light. Number two is halos around the light. Then number three is reddening of your eyeball. Number three is reddening of your eyeball. That's number three symptoms of glaucoma. Then number four, you experience eye pain, and because of the pressure in the eyeball, it damages the optic nerve. So number four is eye pain. And then the last one, number five, is nausea or vomiting. Number five. So those are the symptoms of glaucoma. Those are the symptoms of glaucoma. Okay. So I'm going to share a picture of glaucoma now. Let me share a picture of glaucoma. Let me share a picture of glaucoma with you guys so you guys know what. All right, this is your glaucoma. And now I told you guys, when you have glaucoma, all your eyeball will be red. Okay, this is a health. You see, this is a healthy optic nerve, and this is optic nerve in eye with glaucoma. You see the two different things. Even in terms of the sizes of your eyeball, they are not the same. This has a little bit of enlargement of your eyeball. This one here is bigger than this. Then look at when the optic nerve is damaged. Okay, that has glaucoma. This is a healthy optic nerve, and this is optic nerve with glaucoma. You see the two different things here? Uh, I'm trying to share that picture with you guys. Okay. All right. So this is how your glaucoma is. The one with glaucoma is a little bit of enlarged, and the normal one, healthy optic nerve, you can see it. And you can see this widening of the peripheral or tunnel vision is getting bigger. It's not supposed to get bigger. When you have peripheral or tunnel vision, this is how it's supposed to be. This is the healthy optic nerve. And this one, your optic nerve with glaucoma is damaged. Okay, because the tunnel of peripheral vision is enlarged, and then it's not good. All right. So that's how your glaucoma look like. Look at the peripheral tunnel vision here. Look at the damages. This is how it's supposed to be. So when there's a pressure in the eyeball, it damages the optic nerve. When this eyeball, this healthy optic nerve, when there's a pressure in it, it damages the optic nerve. And as a result, you start seeing all this tunnel vision. Okay. So, if you go to the number three symptoms of glaucoma, we talk about reddening of the eye. When you have glaucoma, the entire eyeball is going to be pure red. Okay. So that is how somebody with glaucoma is. Yes. This one with glaucoma is bigger than this one without glaucoma because in terms of the largeness. So when there's a pressure in the eye, it damages the optic nerve. Okay. So you have a loss of peripheral vision or a tunnel vision. Okay. This is what we are referring here. Okay. So that solved the problem. I believe you guys So I believe you guys, so the optic nerve, okay, the optic nerve carries impulses for sight from the retina in the eye to the brain. It is composed of millions of retinal nerves fibers that bundles together and exit to the brain through the optic disc located at the back of the eye. This optic nerve has a center portion called the cup, which is normally quite small in comparison to the entire optic disc. So in people with glaucoma, okay, in people with glaucoma damage, because of the increased pressure in the eye and loss of blood flow to the optic nerve, these nerve fibers begins to die. This causes the cup to become a larger in comparison to the optic disc. Since the support structure is not there, optic nerve cupping progresses as the cup becomes larger in comparison to the optic disc. So that is how, when you're putting pressure on the eyeball, what happens? It damages the optic nerve. So that is what is called glaucoma. That is what is called glaucoma. Do we have any question? Do we have any question? It's good when I'm not getting question. It means everybody is listening. So we've discussed our macular edema. So I don't want to get into macular edema because at the beginning of the program, I said, let me go back, and I said, uh, there's something I said here. I said high blood pressures, high blood sugar and average A1C levels can mean a higher risk of diabetes-related complications, including eye health issues such as retinopathy, glaucoma, cataract, and macular edema. I've discussed retina, I've discussed glaucoma, I've discussed cataract. Macular edema, we discussed it last week. So you guys know what macular edema is. I have the video on my page. Okay. You know that macula is located at the center of the retina. It's part of the eye that gives the sharp central vision. Okay. Uh, let me share that particular picture to tell you guys. Okay. Let me go back to that eye picture again and share this picture. Okay, I want to share this picture. Okay, so because I'm talking about macular edema, I've told you what floaters are. Those that are these are floaters. See this thing that are look like ringworms are floaters in the eye. Now this yellow line here, should I call it yellow orange line here, is your retina. This is your juice. This anything that has to do with your eyesight, you seeing is your retina. Anything that disturbs the retina can make you go blind totally. This is your retina. Everything that is here is your retina. Now, this is your aqueous vitreous, the fluid in your eye. Now, the floaters are those things that look like worms, are your floaters. That's what we call floaters. I've discussed about it before. I want to tell you guys what is macular edema. Macular edema is at the center of the retina. It's a part of the eye that gives you sharp central vision. So, this is your macular edema. So, this is at the center of the retina. This Everything here is your macular edema. It's located at the center of the retina. Anything, that thing that your eye can catch up that give you that sharp central vision. Everything, only thing about all your eyesight is this. That's your macular edema. Okay. So macular edema is when the macula swells due to leaking fluid. Other symptoms of macular edema include wavy vision and color changes. So when there's a leakage of blood and other fluid into the retina, that is anything that you see here, this is your retina here, okay, and outside it is your blood vessels. and your nerves. So we don't want these blood vessels here to leak fluid into the retina. Okay? We don't want it to leak fluid into the retina. Okay? So macular edema is when the macula swells due to leaking fluid. So when there's a leakage of fluid in the retina here, it swells. Okay? And that's how I start putting pressure on the optic nerve. All right? So due to the leaking fluid, so that is it. So anything that disturbs those retina, anything, we don't want fluid to be leaking or blood to be leaking into the retina. Because when blood or fluid is leaking into the retina, it swells and hardens. So that is how you are putting pressure on your optic nerve to get damaged, and then you have glaucoma issues. So now this is your macular edema because it's at the center of your retina. Okay, so now diabetic macula, which is DM, it stems from diabetic retinopathy. It usually affects both eyes. In my previous videos, I say DME is as a result of your diabetic retinopathy. It's a complication of retinopathy, not a complication of diabetes. You have DME because of retinopathy, because you're not taking care of your retinopathy, then it goes to diabetic macular edema. And after that, it goes to the hole in the macular hole in the eye. So this is what it looks like. These are your floaters. Floaters are those things that look like ringworms in your eye. Okay? So let's stop sharing that and let's get back. So I've said to you guys several times, make sure you go and visit your doctor at all times. It is important you go and visit your doctor at all times. It is very, very important to make sure every year you took an eye exam to make sure there's no leakages in your retina. Okay? My friends, if this is your first time coming across my page, if you've not followed me, let me remove this. Yeah. If this is your first time coming across my page and you are not following my page, kindly do so. All right. And if you have not subscribed to my page, or kindly go to my page in Facebook, YouTube, and subscribe to my page, like, comment, and share. So if you are not yet subscribed to my page, it costs you nothing to subscribe to my page. Go to my page on Facebook and then subscribe. Okay. Continue sharing the page. Give it a thumbs up if you like the videos that you watch in there. So if you're not following my page, kindly do so. I have two pages on Facebook. One is Managing Diabetics TV, and the other one is Living with Diabetics. Okay, so if you're not yet a following member, kindly go to my page and follow. All right. Let me see. Do we have any question? Do we have any question? All right. If you guys don't have any question, I'm going to let you guys go now, and I'm going to return back again in the next couple of hours to do the diabetics forum. We're going to have our diabetics forum today where we answer all the questions. I believe by the time I come back live again, I'll have a number of questions to answer. So if you don't have any question now on this particular topic, diabetics and blurry vision, I'm going to let you guys go, and then we are going to meet on the second live program this afternoon. We're going to be discussing important questions regarding this particular topic or other related topics about diabetics. Okay, so I want you guys to continue watching the video. Watch the video from the beginning to the end. Watch the video from the beginning to the end. You learn a lot of things about diabetics and blurry vision. Okay, so when I return back for the second program this afternoon, we're going to discuss about the importance of diabetics and then answer some questions. All right. So we're going to discuss importance of diabetes eye care. Why do you need eye care as a diabetes? We're going to discuss it and then take some questions in my second program. So friends, thank you guys for inviting me into your home. to share this program with you guys. Okay, and those that are watching me now, I say thank you. Those that are watching me off background in their desktop, wherever they are, I say thank you for being part of this program. And then I'm going to see you guys sometime this afternoon on the Diabetics Forum, where we answer questions. So stay blessed, enjoy the video, and I'm going to see you right back later on today. Goodbye. Do not forget to share. Do not forget to give a thumbs up, and also follow me if you are not yet a following member. So see you guys in my second program later on today. Goodbye.